Springer. I'm a registered respiratory therapist for ProTech Medical. Today I want to talk to you about obstructive sleep apnea and how we treat it. Let's say you've been identified to have obstructive sleep apnea. You must have gone to a sleep lab and where they did a test. Typically they do two tests. One just to determine if your airway's closing, and then they'll bring you back and they'll put a CPAP machine on to treat it and determine what the best pressure is. So let's say you've already had the sleep study done and here you are at ProTech to get your equipment so that you'll get a good night's sleep. First thing that we're going to use is the CPAP itself. This particular model is a ResMed. It can be used just like this. I've got a heated humidifier there that I'm going to show you in a moment. Basically this is the brains and the blower, and I'll show you some features of it. It has a little carry handle to hold on to. There's a digital display here that'll come up to give you some information, including what pressure you're set on. It has a start and stop button. Basically that's the only button that you'll have to use, whether it's this model or any other model. I can set this model to where it comes on automatically. When you put the mask on, start to breathe, it'll start to work. You take the mask off and it powers down. These days, insurance companies are often requiring that we have some download capability so that we can prove that you are using it and that you're benefiting from it. This particular model, by removing this back door, has a place where data is collected, and there's a little smart card in there that we insert into this port right here. It takes about 5 seconds and it downloads all the information, including when you turn it on, when you turn it off, how long it ran, how many times an hour you stop breathing on average, how much your mask leaks, how much you snore. A very detailed report, almost a condensed sleep study. Not only is it for insurance companies, but your doctor will want to know how the therapy is working for you. This blue part back here on the back is where you access the filter. Every machine has an intake filter, and some have two. This one has only one filter, but there's two built in it. If you notice, the blue side is real thin. It catches most of the big particles of dust, but in the back it gets thicker. Some machines will have what's called a pollen filter. That's the one that it catches the big pieces, and they'll have an ultrafine which catches the real small particles. Those most insurance companies allow 2 of the disposable filters per month and 1 of the permanent or pollen filters every 6 months. The heated humidifier is now pretty standard. Most doctors will order you to have a humidifier that you can warm the air up on, and this particular model snaps together and becomes one unit. You can use it without water, or you can lift the lid and add water for there, using it as a cool pass-over humidifier, or you can adjust the heat. This is just a thermostat setting to make the water warmer. The warmer it is, the more water you're going to get, and it's to humidify your system. The other part is going to be your tubing. Standard length is 6 foot, and most people find that that's plenty for them. If you use the humidifier, you may get some condensation in here, so both the humidifier and the tubing need to be cleaned periodically, at least a couple times a week. Put a little bit of vinegar, maybe 25% to 75% water, and submerge it in a basin, and do the same thing with your water chamber, and it'll kill all of the germs. Vinegar is acetic acid. Before you do that, though, you need to clean it in just mild soapy dishwater, like the kind of soap that you would wash in the sink, not in the dishwasher, and just use a little bit of soap so you don't get so much soap that you can't rinse it out. The hose is going to go and connect to the mask. I have 2 masks here. These are the most common. By far the most common is a nasal mask. This mask just fits over your nose, and it's held on your head by what we call a headgear. And this particular one has 2 quick releases at the bottom, so you can, once you get it adjusted, you can take it on and off with just the click of a button like that. so you don't have to mess up your adjustment. Just clean your mask with just mild dishwashing soap and warm water. Rinse it real good. Don't put vinegar on your mask. The other style mask is a full face mask, and maybe 15% of the people, 20% are prescribed full face. Usually it's because when you're at the sleep lab, when you go to sleep, you can't help it and your mouth comes open. So if you're only using a nasal mask, it'll just run into your in your nose and come back out your mouth. So it's a nasal mask and a full face mask. There is a nasal pillow system that I don't have here, where you have two little prongs that go up inside your nose. Most insurance companies will allow you to have one of these long tubings every 3 months. You can replace the mask, which is the hard part, every 3 months also, and the headgear every 6 months. That's basically all the basic components of CPAP, and I hope that you call on ProTech Medical the next time you have a need for supplies or equipment.